by tobacco activists as TAPs. So we know we have banned use of tobacco. Companies can no longer sponsor cricket matches or big this thing. But there is a lot of surrogate advertising going on, as many of you would be aware. A lot of tobacco companies do surrogate advertising, including smokeless tobacco companies. They have tobacco less products. They advertise for tobacco less products, pan masalas and those things, whereas their main intention is to popularize the tobacco-based products. So we need to improve our laws to address these kind of issues. The other thing which comes under this is the banning of showing tobacco. Or now you have to run a disclaimer at the bottom of the screen whenever actor smokes or uses tobacco in the screen. That's also part of this package. And again, a comprehensive ban have been shown to work by review of literature. So all these are evidence-based, and the final strategy is raise taxes on tobacco. Why should we raise taxes? First is if it becomes costlier, especially now we say that tobacco is if rich people are smoking, if you tax, it will have minimal effect. But now we saw that it is the poor people who are smoking. So even a small increase in rate of tobacco, cigarettes or smokeless, this thing will increase, it will have more effect. So it depends on the pattern of smoking in your, and to correct for externalities such as healthcare costs and to raise revenue. Many countries have used tobacco, they lay a cess on tobacco and use it to fund cancer programs or cancer hospitals. So things like that is happening. Another thing that tobacco industry is doing now is that you have banned, in many countries have banned smokeless pan parags and this thing. So they give smoke, comes as a separate pouch, and the smokeless product comes as a separate thing. And people can mix them later on. So they don't sell mixed products. So a lot of industry works in different ways to circumvent the problems that we have if we strengthen our control measures. So again, tax works, especially more in low income countries because that's expected. So finally, as doctors, as healthcare professionals, we need to be a role model. I'm not sure everybody in this room could qualify to be a role model, but we should attempt to be a role model. We should always, as I said, advise on cessation. Make your own premises and even smoke free. We saw that even about 5% of health facilities where second-hand smoking was going on. And influence health and educational institutions to include tobacco control in curricula. Be an advocate for policy change. Prohibit the sale and promotion of tobacco on your premises. Support smoke-free places. So everybody in this room should try to do all these kind of a thing. So finally, my key messages are tobacco is the single most important public health killer in India. A lot of activities are occurring in India, and India has a very strong anti-tobacco lobby, activist lobby, which is what is pushing many of these things. Otherwise, we would not be doing so well. However, tobacco industry always finds ways to circumvent this. So we need to continue working. It is not that we have won this battle. This battle is far from won. It is still going on. And maybe it will take another 10, 15 years for us to really see whether we have won or not. Thank you.
Thank you, Dr. Anand, for giving very nice and informative exposition. So many things has been explained. Anything, queries?
Sir,
Time for queries.
May I say something?
Yes.
There is a small announcement. Actually, after each lecture, there is 5 minutes for interactive session. And for that, there is an award from National Academy of Medical Sciences. So I request all persons who ask or give comments, please tell your name. And I will request Dr. Chavali to please note down the names, and best 1 and 2 persons you can shortlist and later on inform us. It is for the students, yeah. And for all of us, we can give comments and some explanations of that. Thank you.
I need to ask you a question.
Sure, sir.
We have got the so-called Gujarat alcohol-free state. So and so is alcohol-free state. What stops the government from making a particular state tobacco-free?
it can be done. Bhutan has banned, nobody can take tobacco inside Bhutan, and they don't produce tobacco. So it is doable. Political will is required. Largely again, tobacco to convert that, it's also an issue of agriculture. What will happen to tobacco producers? So that has also come into the equation. So government, there are now schemes for alternate cropping of tobacco. So again, in the long-term measure, there is the aim that all tobacco producers will shift to an alternative livelihood by doing some other cropping. So that's a long-term goal, not a short-term goal.
Yes, yes, please.
So I just want to add one point that most of the surveys done in the country, they are based on oral questionnaire or verbal questionnaire as per the statement of the person being questioned. So we did a study about 3 years back, which is also published in Indian Journal of Community Health. I'm an ENT surgeon by profession. We questioned 18 to 40 years population about habit of smoking. And 40% of them who denied, we subjected them to a carbon monoxide check meter, CO check meter, because it is presumed that if you have smoked a cigarette for at least 6 hours, carbon monoxide is retained in the lungs. So we checked it with the CO check meter and found 13% of the denials were false. So it's a presumption that if we add to this incidence level, it will be quite high, what we are simply projecting based on the oral and verbal questionnaire. That is what I want to add to it, sir.
So basically you are underestimating the problem.
Yeah, because what we are saying as incidence, we think it must be quite high. Because a person who is addicted does not admit, because in practice also when we ask the patient, you a smoker, first answer is no. Then when we try to question that.
When we do a national and big level surveys, we are constrained by the resources by which you cannot do that survey in a national level.
It's a very simple tool. Just you hold it, just blow once, and it checks you 3 colors, and the color indication says that he has smoked within 6 hours, whether it's to be included or not to be included. And it is just cost is around just 10 to 12,000 rupees, one smoke check meter.
Good suggestion.
One of the important method by the industry cheats us is I was going through the annual report of ITC. Actually, it was Indian Tobacco Company. They changed the name so that the purpose is hidden. Most of their income or profit is from tobacco. But they, in their report, they say they have social responsibility. That means they are spending money to help the farmers. They don't say that they are helping the farmers to grow tobacco. So these are some of the things which we should be aware of. Thank you.
Thank you very much. It's a nice talk. And Dr. Anand was my senior resident when I was junior resident with him in All India Medical Center in Delhi. So I want to quote a very one of the tobacco crusader died last month. His name is Mr. Deepak Kumar from Maharashtra. So he lost a legal. I'm just reading from Pankaj Chaturvedi's, one of his fighters' Facebook messages. He has lost a big legal battle against Mighty ITC Limited because they filed an affidavit in the court that there is absolutely no proof that smoking causes throat cancer. The second thing, nicotine cannot be addictive. The third and most important person, they lost battle in the court. Cigarette packs already have a warning. Why the person are using? We have given already warning. The ITC people are saying. The fourth evidence, fourth thing they told, there is no proof, no sales receipt. Means when buying cigarette, nobody get a receipt. So the person who has already smoked, so that he has always bought a oil cigarette during the last 10 years. And the country, which 275 million, that means 22.7 crores of tobacco users, not one patient or family ever has compensated for a death or disease or disability. So I think both the things are going up. Both tobacco industry is going up, our campaign is going up, but it's a parallel. I mean, I think India is second largest exporter of tobacco. They have largest largest consumption of the tobacco, but still it's continuing. Thank you.
Yeah, there is always a gap between knowledge and the practice. That is why it happens. It was an excellent presentation, sir. Yeah. Sir, I have a question for you, Director, sir. That our campus, is it absolutely smoke-free?
Whenever the students come to our place, we have given them in written that it is smoke-free, alcohol-free. You see, in spite of that, suppose somebody does it in a room, it's very difficult. As far as our campus is concerned, yes, even in the hospital, you must have seen that we have kept boxes even for people who come. They have to take out their cigarette packets and whatever pouches that they carry, they have to remove them and and it's thrown away. Yeah. So, but in spite of that, you see, all kinds of people come to the hospital. They might be tribals. They may not be aware of what is written over there. But I think we as doctors, we as community medicine specialists or paramedics, it's everybody's responsibility. Like it has been ingrained in our culture, unfortunately. And like Dr. Anand has already mentioned, a lot of it has to do with their livelihood. Here in Chhattisgarh, the tendu patta is grown because it is actually available in the forest and it is collected as a forest produce and BDs are rolled out of it as a major industry. It has its own health impacts, but as long as we don't convert it into an alternative source of livelihood, it's very difficult for anybody, you know, especially from the tribal areas or forested areas. Yes. Yeah, and those brands are doing very well, generating so much of revenue. They're very Sambhaji, and so many brands are there. So that's very same thing. So, but we have asked for all that. We tell them to remove their products that they carry, but I would always welcome more suggestions. I think the medical superintendent also knows that we have boxes kept everywhere. But you see, finally, it is all awareness. You see, we cannot. Certain things are very difficult to enforce, like. Dr. Krishnan has again very rightly mentioned that we have got excellent legislations in our country. Implementation is the only question. At least the healthcare facilities should be totally smoke-free. Legislation is there in many cities. In Chandigarh, you cannot smoke out in the open. But all states do not have a similar law in many cases.
Yes, I take this opportunity to request that we should try to enforce it stringently. Because we have it, I mean to say the...
Yeah, it is our responsibility.
Yeah, so in this symposium itself, I suggest that we should take up seriously. Our department even can take up this initiative.
We will require everybody's help,
yeah,
and especially yours.
Yes, thank you, sir.
There's a question there. Somebody wants to ask a question there.
Just pass the mic there. Introduce yourself.
Which is more harmful, alcohol or tobacco consumption? And if, which should be banned first?
Which should, I don't know. The problem with, especially with alcohol, especially with medical fraternity, that we are often given the impression that some alcohol is good. So there is an ambivalence in the way that the medical fraternity deals with alcohol. Even WHO for many years did not say it very clearly. Today, WHO has changed its stance. They are saying that no alcohol is the best one. Because we have to define generally what is optimal. Tobacco, obviously, optimal is zero tobacco. But for many years, we used to define optimal alcohol as 2 drinks a day, or for men and 1 drink for women.
But we have banned or license for alcohol consumption.
I would say alcohol is more of a social problem. Tobacco is more of a medical problem. So it depends on the context in which you are talking. Alcohol definitely has a large social. The main proponents of ban of alcohol are all social reasons. They are not. Nobody is asking you to ban alcohol for medical reasons. Domestic violence and those kind of things are what are driving the alcohol prohibition, not medical reasons.
So, what is your name? You please pronounce your name because there is a award.
Shashi Shekhar Dubey.
Okay, and you are from which class or?
MBBS second year.
MBBS second year. Okay. So those who are in the evaluation, they please note it down.
The number of passengers that travel on the airports, it's similarly something can be done like that.
But it is done. It is now mandatory for airports to have a enclosed space for smoking. Otherwise,
Absolutely.
all airports internationally now
All
are
international airports are today
smoke-free.
non-smoking.
Yeah. So in fact, people don't want even that.
Which is a major
That there is no need for even that place for smoking.
Correct.
Because ultimately that airport is a closed environment. It comes back into the circulation. So there is an aim to even do away with that. So. Okay, thank you.
May I request the chairpersons to present a memento to Professor Dr. Krishan Anand. I'll request the chairpersons to present a memento to Dr. Krishnan Dutt Chavli, sir. Let's have a break of 5 minutes. We meet here after 5 minutes for the next session. Thank you.